CLCs. We use evidence-based practices. All of our material comes from up-to-date research, textbooks, guidelines from our professional organizations. So we feel like it's a very well thought out, up-to-date, evidence-based curriculum. The first course that we offer is the Lactation Education Counselor course. And as Rose mentioned, she's one of the instructors for that one. Rose, do you want to talk a little bit about this, kind of give an overview of this course?
Sure. This is a great course. It's 45 hours. So if you're a nurse and needing continuing ed credits, you get 45. It is a prerequisite if you're planning to go into the lactation consultant program. We cover basic management of breastfeeding, looking at all the benefits, the risks of not breastfeeding. Of course, there's assignments and quizzes, but we have 2 to 3, usually 3 live Zooms where I meet with each of you as a group and individually if needed to discuss cases, answer questions, and it's just a great course.
And just so Rose is one of the instructors, and each instructor has their own section, so their own cohort. And we have other instructors who also teach this each quarter. And the course itself is asynchronous, which means that there are recorded lectures that you can watch on your own time. The readings and homeworks can be done in your own time, although the homeworks do have specific due dates. So you do have to get the assignments in. You can work ahead in the course. You just can't fall too far behind. And then all of the instructors, like Rose was saying, do offer a live Zoom meeting to answer questions, go over cases, that sort of thing. This course also fulfills the academic and the counseling skills requirements for those who are interested in taking the certified lactation counselor course, that exam. It is not the only requirement that you have to have completed if you want to take the CLC exam. So you should, that's given by a separate organization. UCSD is not the certifying organization for CLCs. So if you are interested in that, you want to look at what those requirements are. But just know that this course fulfills 2 of them, the academic and the counseling skills requirement. All right, Megan, you want to go to the next slide, please?
Sure. Oh no. Hold on 1 second. It's not letting me go to the next slide.
Well, this is a good time to say that being an online class that is asynchronous, there's always going to be some tech issue. And I will say that it is important to know that you can, you have the internet capability, your computer is a good one that's not going to fail you for the classes. I will say recently, I don't know if iPhones, because they have gotten so much more advanced that everybody is really just using their iPhone, but it has come to light that more of our current students are using their iPhone to complete the class. And that is not I would not recommend counting on that. We use Canvas, that's our learning management system. And Canvas, it's not really compatible with tablets and smartphones. So just kind of be thinking of that. You want to have something other than your phone to take the classes with. Great. So the next class is the Lactation Education Refresher course. And I will ask Rose, because she created this course and teaches it with Ali Barrere. So Rose, do you want to talk a little bit about the LER course?
Yes. We just redid it 2 years ago, and already I have to update one of the lectures, but it's designed for those that need to get their credits for refresher, but you could also get CERPs for lactation. We tried to pick topics to update everybody on. For example, one of the topics and lecture is things that, you know, from an ethical standpoint, you know, situations that kind of make you go, something maybe that you've never experienced, but techniques on how to handle some of those. Also scripts. patients will ask you, why is this better than this? To give you some tips on how to answer that. A big one is resources for lactation professionals. And it includes an enormous number of resources out there. Some of them I didn't know about when I was preparing the presentation. So it's 20 hours and it's again online, and it's over a 5-week period. And we also have live Zooms for the refresher course as well, to discuss any questions you might have about the lectures or anything like that.
Yeah, so again, this course is asynchronous in the sense that you're watching recorded lectures, except it does have this live Zoom component. The Zooms that we've been talking about in the courses, LEC and LER, those also are not required. They're not mandatory, they're optional. So if somebody couldn't make it because of their work schedule or something like that, don't worry, it doesn't affect your grade in the course. Okay, so the next course we'll go over is our Pathway 1 Lactation Consultant Education Program. So this is for those who are interested in becoming IBCLCs and who either already come from a healthcare background, they work with breastfeeding or chest feeding dyads already, or they've already identified how they're going to complete their clinical hours. So per IBLC, the requirements for Pathway 1 to be a Pathway 1 candidate is you complete the 95 hours of lactation-specific education. That's the didactic course. That does include the 5 extra hours of counseling and communication skills. And it's 1,000 clinical hours. So if you're somebody who works in healthcare and you work with dyads, let's say you're a postpartum nurse and that's a lot of what you do as a postpartum nurse is work on breastfeeding. You're kind of counting those on the job hours towards your 1,000. UC San Diego, we do not provide clinical hours. We do not place people in a clinical setting to complete those clinical hours if you're enrolled in the Pathway 1. That is your responsibility, and we assume you've already figured that out if you've enrolled in our Pathway 1 program. Our Pathway 1 program is strictly the didactic. So if you have questions about clinical sites, I'm happy to give you some guidance, but we don't place Pathway 1 interns. You cannot represent yourself as a UC San Diego student because we don't have an affiliation agreement that encompasses that internship that you're working through, and you're not covered by the UC San Diego malpractice insurance. All right, next slide, please. All right, so then that next leads us to the Pathway 2 Lactation Consultant Education Program. And to be a Pathway 2 candidate, what makes Pathway 2 different or unique is that Pathway 2s are programs that are housed within a university or college setting. So they are CAHEP and LARC accredited programs, and they provide the same 95 hours of lactation-specific didactic, including those extra 5 hours of counseling and communication skills. The clinical piece is different. If you're a Pathway 2 candidate and you're in a Pathway 2 program, you're required to complete 300 clinical hours. And the course, the program that you're in, the university or college is finding you or setting you up for your clinical hours. So at UCSD, we work with preceptors all over the country. I guess I should say Pathway 1 and Pathway 2, just to be clear. The didactic piece that is also asynchronous, like our other courses, it's recorded lectures. Those can be done in your own time. Readings and assignments can be done in your own time, although the assignments do have due dates. So again, you can work ahead. You can't get too far behind because you need to stay up on top of those due dates. And because of that, we have people from all over the country who attend our Pathway 2 program, and we work with preceptors in their geographical area. We work to get affiliation agreements with facilities, whether it's hospitals, clinics, private practices, and we place them and work with them and their preceptors so that they can get those hours. Those 300 clinical hours do need to be completed within our program. So it's a 9-month or 3-quarter time period, and you have to complete all 300 hours during that time. Our curriculum for Pathway 1 and Pathway 2 follows the IBLC detailed outline, which is what they give for people to kind of have a sense of what the exam is going to entail. And we also follow the LARC clinical skills checklist. So remember I said LARC is the accrediting organization for our Pathway 2 program. They also have approved our Pathway 1 course. And so we use their checklist, which is much more detailed and specific than the IBLC detailed outline. And we make sure that we really get all of those key skills talked about in the program and the material. So Pathway 2, if you're in the Pathway 2 program, you are completing your didactic requirements and your clinical hour requirements concurrently at the same time while you're in our program. So a little bit about our clinical placement process, because this usually brings up a lot of questions for people who are interested. When somebody applies for our Pathway 2 program, which starts in the fall, in the part of the application will ask for your top 3 clinical sites in your area. So we will work really hard to get you one of those sites, but there's a lot that goes into that relationship. If it's a site that we haven't used in the past, we have to start off first by entering an affiliation agreement with them or a contract. That process in and of itself can take months. So we try to start this, like we're getting ready right now. We have our fall cohort starting in September. I've been working on clinical placements since March. So we definitely try and do this very far in advance so we can get as much done as possible. The next thing that happens is once we identify a preceptor, we've got the contract going, then the intern will work on their onboarding requirements. All of the facilities will require onboarding. Megan's going to talk a little bit more about that. But it's things like your background check and your immunization record. When we also identify a preceptor for you and we get you in touch, the student in touch with a preceptor to work out the schedule, it's really important for students or interns to recognize that your schedule has to be flexible and match the preceptors. Like I said, I have preceptors all over the country. I can't possibly know everybody's schedule, but also this is their job and they just go to work and you join them. So you have to be flexible in terms of when they're available and working to give you those hours. So if somebody has a very rigid schedule with little flexibility, like you're only available for nights and weekends, not every site has lactation coverage during nights and weekends. So that's not a guarantee. So I do just really encourage people to kind of find some flexibility with that. So 300 hours over the course of 9 weeks comes out to around 10 hours per week, because usually that's what people are asking, how much do I have to do each week? And that's a little bit padded because I anticipate somebody's going to go on vacation, whether it's you or your preceptor, somebody's going to get sick. Most people don't do a lot of hours during December, for example. So some weeks you might work less than 10 to 12 hours, and some weeks you might work more. That's just to give you a very rough estimate, but really you just got to get 300 done by the end of the program. All right, next slide, Megan. All right, Megan, do you want to talk about the onboarding stuff?
Sure. So for students in Pathway 2 that do have a clinical site, many of our clinical sites like hospitals, clinics, private practices require students to have immunizations. So these are some of the immunizations that are typically required. The first one, tuberculosis, hepatitis B, measles, mumps, rubella, Tdap, varicella, flu, COVID-19. So those are usually it's that list. You can find your immunization records. Sometimes your state has a registry, like California has one, so you could potentially look up your immunization records there. You could also, potentially, depending, talk to your parents, look in your baby book, see if they're around. It kind of depends on the immunization to see how far back it can go. But typically the ones that need to be done more recently are tuberculosis, flu, COVID-19. So those are the common immunizations. And then the next slide, many of our sites also well, I think our program requires that students have the basic life support through the American Heart Association. And so we ask for adult and not neonatal. Typically, sites require a background check and drug screening. That we use a third-party company called Complio, and they provide the background check. You just type in, your personal information, and they run the background check. And for the drug screening, I believe they coordinate a lab near you, whether it's I'm blanking on the labs, but like common labs like Quest, a local lab where you bring in basically a form and have your drug screening completed. And then sometimes each site has paperwork or learning modules specific to their site that they want students to complete. It sounds like a lot, but I work with students through the process until we get it done. We get it done and you start at your clinical site. So that's the typical requirements.
So this onboarding process, that has to happen before you can start. So again, kind of going over the timeline again, you apply, we find you a site, we make sure the affiliation agreement is in place. Once that's done, then you work with Megan on your onboarding. So that too can sometimes take a long time if you haven't had your immunizations up to date, because immunizations are not always done all at once. You have a series and a timeline that you have to follow. So some of them are like the hepatitis B, you're getting 3 shots over a 6-month period. So be thinking about that ahead of time, because you can't start your clinical hours. You can't go into your site until this piece is complete. And if it takes longer, that means less time to complete your hours. So just kind of be thinking like, how much do I have done already? So I mentioned before that the Pathway 2 program is accredited through LARC, and the Pathway 1 and the LEC programs are all endorsed and approved through LARC. Our programs are also accredited through ANCC, the American Nurses Credentialing Center. So we go through an accreditation process for all of our courses through ANCC. So that's a really kind of nuts and bolts overview. Here are all of our email addresses. If you have specific questions after today, I would say screenshot or take a picture. Our emails are also on the website, but certainly you can reach out to us individually. But we definitely have time for individual questions. So I would just ask, just so we can kind of all hear, get a chance and hear each other's questions. If you could use the raise hand icon, which you should see at the bottom. If you're new to Zoom, you should see that at the bottom. Lou Atkins, she got it. She got that raised hand and she's first. Excellent. Yeah, Lou, what question do you have?
Yeah, so my question is, what is the price difference between Pathway 1 and Pathway 2?
So Pathway 1, there is a difference. You're just getting the didactic. So that one is $11.95. Carol, tell me if I'm wrong. $11.95, and then the Pathway 2 is $7,500.
Okay.
And the Pathway 2 does have a prerequisite of the LEC. That is not a prerequisite for the Pathway 1, because again, that's usually those people are health workers that are already working in their Pathway 1, so they don't need the LEC. The LEC, though, everybody has to take if they're going to be in the Pathway 2 program. That way we know everybody's kind of at baseline knowledge for when we put them in their clinical site. So there's that cost as well for Pathway 2. Melinda?
Hi, I'm just having a hard time deciding if I need Pathway 1 or Pathway 2. So I'm a registered nurse. I work in labor and delivery. I work with lactation consultants, and I do a lot of breastfeeding support. So it sounds to me like I could do Pathway 1.
Yeah, we get this question a lot. I mean, you know what's best for you, but what I will say is think about, so when you're collecting your education and your hours, they expire after 5 years in terms of when you apply for the IBLC exam. So if you apply today for the exam, you can only go back 5 years. So
Okay.
that's what I would say is one, think about like, if I go back 5 years, do I have 1,000 hours? IBLC does have something called a clinical calculator. That is just a spreadsheet that they've created to help you kind of track your hours if you're planning on doing a pathway 1. You could use it for pathway 3 as well. But the way they've kind of figured it out is they assume if you're a postpartum nurse, you probably 20% of your day is breastfeeding. If you're an L&D or even a NICU nurse, it's probably more like 10%. So that's kind of how they're thinking. If you truly believe, no, I do more than that, then you can, chart that and put that on the spreadsheet. You don't have to be supervised for your hours for pathway 1.
So I would just fill out the sheet and kind of figure out how many hours I've gotten done.
Well, that's
And
where
then
I think I would start.
How do they confirm that you actually did those hours?
I'm gonna put this calculator that I'm talking about, which is just
I
a
saw it
spreadsheet.
on your website, but the download doesn't work. I was going to mention that. It's in your frequently asked questions. So I
Okay,
tried to
thank you.
download that to look at it, and it just took me to a weird advertising site.
Okay, well, thank you for letting us know. Well, then
Okay,
click on
Christina?
that link. That should work. Yeah, Rose.
Kristen,
Yes. I'd like to just add my 2 cents worth on clinical versus no clinical.
uh-huh.
I've been a preceptor until I retired a few years ago for many, many years. And the difference is, as a labor and delivery nurse, as a postpartum nurse, yes, you see moms and newborns, but you only see newborns. When you do the clinical route and you are in an outpatient clinic, you are going to see cases that you will never see in labor and delivery and postpartum. You're going to see the failure to thrive. You're going to see babies that have been diagnosed with issues that, whether it be excessive jaundice or weight loss. And the students that I see that do clinical versus the ones that don't, I personally and professionally see a difference in the quality of their consulting, because they are exposed to so many more cases that you wouldn't see if you're just working labor and delivery and postpartum. So while I know it's more expensive, but the clinical experience you will get is so valuable that anyway, that's just my 2 cents worth, that I think there's really value in the clinical part of the program.
I would agree with those 2 cents. I would also say that the other piece of it is the pathway 1, you don't really have a supervisor. And so sometimes that can create its own issues if you're not really working with a mentor to say, yes, this is a better way, or no, that's not a better way, that kind of thing. What I would say is if you're interested in the pathway 2 and you really like your lactation team, then, potentially if we could create an agreement where they're your clinical site too, if you really want to kind of stay. I mean, we have done that for some places. A lot of places are more willing to take interns if they're employees already, and then you've already done the onboarding piece, and we
Right.
just have to get the contract set, but that's another possibility.
Well, that answered my other question. I also, our lactation at our hospital, we're a very small hospital in Northern California, and we have a lactation consultant or a center in the hospital, and they do a lot of outpatient treatment and the failure to thrive and all of that stuff as well. And they actually invited me to join their Nursing Mothers Council here in town and do their spring training with them. And they said I'd be able to get a lot of my hours through that. So that's
well, it sounds like, I mean, not to muddy the waters, there's also a pathway 3 that we do not, UCSD does not do a pathway 3 route. Pathway 3, it's the same didactic. So you could take the pathway 1 course with us and you would get your 95 hours of didactic. The clinical piece is done separately. That's like a mentorship. It's 500 hours. You do have to have a relationship, an official relationship with your mentor. You create a proposal of what you want your mentorship to be, how you and your preceptor, your mentor, I think they call them more mentors than preceptors, how you plan to execute this clinical experience. And you have to have that approved by IBLC before you move forward. But once it's approved, you can move forward, and that's 500 hours. So if you're going to do something that specific, and you can email me and we can talk offline about that if you have questions, or you can just contact IBLC, but that might be another option for you specifically.
Yeah, that does sound like a good option, because I actually have one of them kind of like snagging me and going, you want to be a lactation consultant, don't you? Because they like when I'm working, I make their job so much easier, because I do a lot of the teaching and I do a lot of the support, and I'll get them all set up breastfeeding, and then I'll just let lactation know they're feeding.
Yeah, cool. Well,
Awesome.
we can talk about that offline if you want to reach out.
Okay, I'll reach out to you personally.
Okay,
Thank you.
sure. Lauren?
Yes, hi. Could you talk a little bit more about entering the Pathway 2 program with the prerequisites of having the health specific coursework and not already being a health professional?
Yeah, so if you're not a health professional, there are health science courses that IBLC requires, and those need to be done before they're considered prerequisites for our Pathway 2 program. Is that what you're asking? Did I answer your question?
Yeah, so it would be basically the same onboarding process as long as you have those prerequisite classes done.
Yeah, so actually you need to do, and Carol, chime in if you want, but you have to do those prerequisites. So you have to do the 14 health science courses and the LAC and have those completed before you apply. And then once you're accepted and we have a site identified for you, that's when you would start the onboarding process.
And I'll just add, the only exception is for the LEC course. Our application window for Pathway 2 closes on June 30th. So you can get your application in now and still take the summer LEC course to qualify for the Pathway 2 program.
But you'll have to have your 14 health sciences already done.
Yes, correct.
Okay, gotcha. Thank you so much.
Yeah, right. Are you the same, Lauren? Are you on 2 devices, Lauren?
Yeah, I am.
Okay. All right. Next is Ray.
Okay, so I have completed all of my 14 health sciences courses, and I'm signed up to do the lactation education counselor course in June. I want to do Pathway 2.
Okay.
What do I need to do to apply? Like, do I go on?
You want to apply for the September cohort for September?
Yeah,
start?
yeah.
Yeah. So if you go on our website, there's a button there that says apply now.
Okay.
Click.
Okay.
That's it.
Okay.
Yeah. And when is that open? That's open till June 30th, right, Carol? Yeah. Okay.
Yeah.
Yeah, Logan. I think you're muted, Logan. I don't hear you.
Is that better?
Yes, now I hear you.
Okay. I am looking at Pathway 1. I'm currently a NICU nurse. I've been a NICU nurse for about 3 years, and I have somebody that I would want to complete the additional hours and education with. I have someone in mind. Other than having I have my bachelor's in nursing, is there additional prerequisites, or I'm a little bit confused on that area?
Not for the Pathway 1. As long as you can prove that you're a nurse, I think Carol's just going to ask for your license, right? Carol, you just asked for.
Right. You can either, when you're submitting your application, you can either upload a copy of your license or your transcripts, whatever's handy. And that's about it.
And then in addition to I know you guys mentioned the the spreadsheet for calculating hours. Once I would say okay, this, I copied the link, so I figure out how many hours I have. And then from there on, would I prove oh, I'm going to work with this person on these days for this many hours, or would I just keep a tally for myself?
Well, as Pathway 1, you pretty much keep a tally, but if you're audited, you're going to have to show them that tally.
Got
So
you.
They say that pathway one doesn't have to be supervised, but those kind of questions I would refer back to IBLC since they're the ones who would do the auditing and all of that. You want to make sure you're getting their answers.
Okay.
Yeah.
That's good. Thank you.
Uh-huh. Yeah, Angelica?
Hi, so I'm a midwife and I'm planning on doing the pathway one. My question is about the clinical hours. I have clinical hours from before I was a midwife. It's still within the last 5 years, but I'm wondering, are the hours I can count, the 1,000, need to all be from the time that I was a midwife since I'm doing pathway one, or they can be, like I was an IP, I did CLEC program through UC San Diego before, and that's why I was having lactation hours then.
No, it's just lactation hours. As long as you, as a pathway one, as long as you have worked with breast or chest feeding dietes for 1,000 hours within the last 5 years, that should cover it. You know, you can certainly look at their website, but you don't have to be a midwife or a nurse or anything like that to go through. You just have to have a legitimate way that you've been completing those hours.
Okay, and then also take the consultant course, the 95-hour class.
Right, yeah. Mhm. So
Okay.
one is your clinical requirement, one is your didactic.
Okay, perfect.
Yeah,
Thank
but
you.
I would just review the pathway one portion of the IBLC website just to make sure that it makes sense to you for your
Mhm,
situation.
I will.
Yeah.
Thank you.
Yeah, Julia?
Do you take transfer students, like if, or I guess two-part question, do you take transfer students? And then also if someone had completed the like 95 hours, is it able to be like, is pathway 2 able to be split so that you just did the clinical portion, or is it like inherently tied together?
They're inherently tied together unless you did pathway 1 through UCSD. If you did your 95 hours somewhere else, we don't accept that as a transfer. So you would end up doing the pathway 2.
Gotcha.
Which is you would end up doing the didactic. You'd be really educated.
And broke, but that's good to know. Thank you.
Tina? Oh, we don't hear you, Tina.
I have a question.
Oh.
Hello?
Hello? You're kind of going in and out a little bit.
Can you hear me? This is Rita.
Yes, now I can hear you.
Yeah, I just want to ask about the pathway 2 of getting lactation. So do those prerequisites those you showed in the UCS San Diego, if I finish those, is that okay to apply for lactation? I have to finish other stuff.
You have to finish your 14 health sciences first.
Uh-huh.
You have to finish those courses before those classes before you can apply. You also need to do an LEC, the Lactation Education Counselor course beforehand. If you have done your 14 hours already, your 14 health sciences already, and you still have your LEC course to take, you can do that in the summer and apply for that pathway 2 now. And we'll just know, okay, she's going to finish the Lactation Education Counselor course this summer, and she'll be all done and ready to go with pathway 2 in September.
But some of the classes you offer them in UC San Diego for the protein science classes.
Correct.
So if I'm almost done with everything, so do I have to apply for the other classes which I didn't do it? Oh, I'm still confused there.
Are you going to be done with all of your 14 health sciences and the LEC by September?
I'm done with LC. I'm gonna be done this December with all the pathway 2.
Oh, December.
Yes.
You're going to be done with your 14 health sciences in December.
Yes. I just followed the UC San Diego, the whole thing.
Yeah, so pathway 1, but you're asking about pathway 2, right?
Pathway 2, yes.
Yeah, so Carol, that's a Carol question.
I'm sorry, can you repeat the question, please? I was typing.
She finished the LEC course already, and she's currently enrolled in some of the 14 health sciences, but they won't be done until December. And she wants to apply for September. And I think that's too late, right?
Right. You're certainly welcome to shoot me an email if you'd like to send me your your class schedule and what your anticipated class completion dates, I'd be happy to look at it, but we have told students that the prereqs have to be completed prior to the start of the Pathway 2 program in September.
Yeah, so that would be Carol that you would email.
Okay. All right. Thank you.
Okay. Renee?
Hi. I did type this out in the questions, but I still have the question. I live in Maui and there's only 2 IBCLCs here, and I called them both, or 2 that I know of anyways, and I called them both, and one has a private practice, but she's already precepting somebody, and she thinks that she's going to end up leaving Island soon anyways. And then there's another one who recently moved from the hospital to outpatient. She's like, it's all so new to me. I don't really want to take on a student right now. So if I wanted to do, I just finished, or I'm finishing the LEC program, and if I wanted to go on to IBCLC, my main concern is not being able to find anybody here to precept with.
Yes, I will say I'm sorry that that is your experience. That is a legitimate concern, and we do see that in various places. Like, for example, in your situation, if people are just living in lactation consultant deserts where there just aren't a lot of preceptors, there aren't a lot of options. So again, we do everything that we can to reach out to as many places to try and find a preceptor. But unfortunately, if for some reason we're not able to place an intern, then we just have to say, I'm really sorry, we can't accept you in the program, and your intent to enroll fee would be refunded. And unfortunately, we have had that happen in the past. So for you, as much as you can make connections and network, I mean, if there literally are only 2 people, have you reached out to the hospitals too?
The hospital has had a position posted for a year for an IBCLC. They don't have anybody there. And I did call the L&D manager and just asked, like, would you be willing to employ me and I can learn, on the job and maybe do the Pathway 1. She's like, oh, just call me when you're certified, which I've thought about calling her again, just now having the LEC certification and just saying like, hey, it's not IBCLC, but would you consider hiring me and I can still do the 1,000 hours on the job.
Did you take the CLC exam?
No.
So just to be clear, just to clear this up, so the LEC, that's a course. And you've graduated, and it's not a certification. So
right.
You're not really certified. So
right.
Clear.
Sorry.
Well, just if she cares,
Right. Well, I have the education, like I'm, I at least would have more education. Anyways, I just don't know if that would be even getting myself in a difficult position to be like their supposedly lactation, specialist, and then not really having any clinical experience at all. I mean, I can always reach out privately about it too, but
yeah, you can reach out privately. My suggestion would be, if you really were interested in Pathway 2, go ahead and apply, and we would work to find you a site and figure that out as much as we could. And if we can't, then you'll be refunded, and
okay. Yeah, I'll email. Yeah. Okay. Okay. Thanks.
Sure. Genesis?
Yes, hi, thank you. I guess this question is probably for Rose. I just completed her course for the lactation education counselor. And then when applying to the exam, it's asking for the skills attestation and the resume of the counseling skills attestation supervisor. I was just wondering when we would be receiving that, or like the group that who just finished the course would be receiving that.
The resume is on the syllabus.
Okay.
And as soon as the court, well, I can send you yours now if you've already done your, so I can just make a note and send you yours. But I do email them out toward the end of the course, and once they're all graded in the course, and yeah.
Perfect. Oh, take your time, but thank you so much.
Okay.
And then my second and last question would just be like, is there any additional resources you'd recommend for us to study for that exam, or do you think I could just review our slides from our class again and just
And the book, I think the book is a great book.
Okay.
You know, just really understand basics, anatomy, physiology, and latch and common feeding patterns.
Right. Okay. Perfect. Thank you so much. That was it. Thank you.
Yeah, Rachel.
Hi, so I am a nutrition researcher and I'm starting to get into lactation. And so I'd like to get some formal training and I'm planning to take the LEC course in the fall. I'm interested in doing the Pathway to program. I just wanted to check because I have advanced degrees in health sciences. Do you know if I have to take the 14 health science prerequisite courses, or would my previous work kind of count towards that?
Yeah, I'm gonna guess you're fine because we've had,
Okay.
but Carol is the expert on that. So what I would say is if you email Carol and send her your transcripts, that way she can actually look at them and see what you have taken and she can let you know.
Yep. Okay, thank you.
Mm-hmm. Yeah, Raksha?
Hi, can you hear me?
Yes.
Hi, so I'm a pediatric dentist and I'm from India.
Mhm.
So I wanted to look into the pathway 1. So in case I choose the pathway 1, so it would be my responsibility to find somebody whom I can shadow under, right, to complete those 1,000 hours. So what
Correct.
should be credentials of that person that I'm going to shadow?
Anybody that you get you're just to be clear for Pathway 1, you're not just shadowing, you're actually doing it. And somebody, you might have a mentor, but they're there as your support. But the idea is that you're doing the hands-on, and that person has to be an IBCLC, or you have to be working with breastfeeding, chest feeding dyad, but you're not just observing or shadowing.
Yeah, so it would be my responsibility to find the IBCLC, right?
Correct.
Okay. And as I said, so do I have to take those additional courses, the subjects, or shall I also mail my transcripts and then you can find out if I need
No,
to
if
take
you're
those?
a dentist is counted as one of the health professionals, right, Carol?
Yes,
Yeah,
correct.
so you're fine.
Yeah, but I'm not a dentist in US. I mean,
That's fine.
I don't, yeah, because see that's international.
Right.
Okay.
Yeah. All right.
So if you need any additional information, whom do I email to? Any one of you or?
You can email me directly, Carol Landry.
Okay, thank you.
Of course, thank you.
Thank you so much.
Athena?
Hi, can you hear me?
Yes.
Okay, great. I was wondering, I have 2 questions. Do you offer the health sciences or is that something that we do separately?
UC San Diego, the Division of Extended Studies does offer the health sciences. I think it's all but one, right, Carol?
I think so. I think it's the sociology class that we don't offer, but I think everything else you should be able to find with us. And if you've taken classes at the community college, we'd be happy to take those as well.
Yeah, I have about half of them for my bachelor's, so I'm trying to kind of like source the rest of them. So just thought I would ask. The other question I had was, so I've gotten some emails from like International Doula Institute. What is the difference between like your program and their program? Or is that something that I should figure out because you don't know what they do?
Yeah, I don't know what their deal is, but what I mean, are they doing is it a doula course or is it a lactation?
Well, it's a lactation course. It was confusing about what I would end up with if but it looks like a 9-month or 6-month course and then you take the test. So I'm wondering if that would make me like a step below, like.
I don't know. That is a question for them because I don't know. Yeah, I know it's not a Pathway 2 program. That part I can tell you. It's not a Pathway 2 program. It's either going to be a Pathway 1 or a Pathway 3.
Okay, that helps a little bit. Thank you.
Yeah. Yeah, Emily?
Hey, I'm a speech therapist in North Carolina, and I work with kids with pediatric feeding disorders already, but have done like no breastfeeding. Do I need to do pathway 2 with that? Would that be the best route?
Yeah, if you don't have any breastfeeding dyads that you're already
Like
working with or
2
experienced.
parents come in, like 2 families come in, and that's about it in my 3 years.
Yeah, then it's going to take you a long time to get 1,000 hours. So I would say, I would say pathway 2.
Okay, because my boss wants to open, like, she wants to add on to our feeding practice and do lactation consulting. Is that a possibility? Do you
Sure.
think? Okay.
Yeah. Yeah. So we would just need to find you a clinical site in your area. So start
We
networking.
have a local hospital like right across the street from us.
I know, it sounds so easy.
It does, but I don't know like if that would work or not. And we're like, you know where Charlotte, North Carolina is?
Yes, but I don't know if it would work or not either. That's what I'm saying. Like network and then send us the information.
Yeah.
And try to make it happen.
Awesome. I think my boss knows a local lactation consultant, so I'll talk to her about that.
Yeah.
Awesome. Thank you.
Uh-huh. Yeah, Vanessa?
Hi, I have a question. I just graduated with a bachelor in nutrition and food. So which pathway do you recommend?
Do you work with breastfeeding or chest feeding dyads now?
No, I just graduated like what, 3 weeks ago?
Yeah, so then I would say if you have a way to get your clinical hours, then you can do pathway 1. But if you don't, then pathway 2 would be a better bet because that's part of what pathway 2 is. It's finding you a clinical site.
Okay. And my second question is, do I have to take the 14 course for the health science?
Probably not if you've done nutrition, but you might want to email Carol your transcript and that way she can just look it over and double check.
Okay, thank you so much.
Uh-huh. Yeah, Kimmy? Well, you're muted, Kimmy.
Okay, here I am. Hi, how are you?
How are you?
I'm good, thank you. So the question I have is, I've always had interest in doing lactation consulting, but where I work, I've been there for 18 years, and I thought that you had to be a registered nurse to do the consulting for lactation because that's literally all they have there. As an LVN, I am assuming I will be doing pathway 2 because I don't have the experience with the didactics part of it, and I would need to get that and not be able to get it clinically because I am actually now a telehealth nurse, so I'm not even in the clinical setting at this moment.
Okay.
I was wondering, the 14 prerequisite courses, I know under a nurse, does that mean I qualify under the nurse part as an LVN as well, or is that just for registered nurse?
I'll defer to Carol.
Okay.
Did you hear that?
I'm so sorry. I'm typing and not listening at the same time.
That's okay. So Kimmy is an LVN and
Yes.
she's wondering, does that count the same as an RN in terms of her 14?
Oh,
Like a
absolutely.
professional or
Yeah.
her 14 health.
Yes, of course.
So she's already, she's good to go on her 14 health sciences.
Yes. If you're interested in pathway 1, you wouldn't need the LAC class. If you want pathway 2, you would need to take that as a prereq. But other than that, you're all set.
So I'm not in a clinical setting and I don't have experience with breastfeeding or lactation. So I was assuming I would be on pathway 2.
Yeah.
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 Yes,
I think
the LAC
that would
course.
be a better bet.
I'm sorry, repeat that for me, Carol.
Just the LAC course. And if you wanted to join the fall cohort, you can enroll in our summer course that ends September 16th and still be eligible
Okay.
in the fall.
Okay, awesome. Thank you guys so much.
Sure.
Sabiha?
Hi, so I completed my 14 general ed requirements. I also completed my CLE through Evergreen Perinatal. And then I've worked for WIC for the past 5 years, providing breastfeeding support. But I recently quit, and I just signed up for Pathway 1. But I don't know, I feel confused. But I feel like that I should be completing Pathway 1.
Well,
yeah.
How are you going to get your clinical hours?
So I completed them like in the last 5 years.
Oh, you've already got 1,000 hours?
I assume so. I guess I would have to,
Yeah, I would go back and double check. I wouldn't assume.
yeah, I guess I would fill out the sheet, but since I work providing breastfeeding support under like an IBCLC, I don't know how I guess because every day I would provide breastfeeding support. So for the 5 years that I've worked at WIC, so I'm assuming that would count.
Yeah, I mean, I don't know how many hours you worked, but if you worked like enough hours to equal 1,000, then sure.
Well, for that particular position, I think you can use 80% of the hours you've completed over the past 5 years. So if you worked full-time in that 5-year period, you should be good to go. I'd recommend Pathway 1.
Okay, perfect. And then, okay, and then I plan to like maybe continue working or volunteering like in the field, so I can keep, because since I just quit, yeah, then, yeah. So I guess just to keep up with the hours, right?
Sure.
Yeah.
Yeah, if you've already got your 1,000, that's great. Then all you have to focus on is the didactic piece.
Okay. So then all I have to do is Pathway 1, and then I can apply for the exam. So nothing else to do.
Right.
Okay, awesome. Thank you.
Sure.
Yeah, Ray?
Yeah, I'm really confused because I'm looking on the website right now and I only see that there's a course. I don't see the place to apply for Pathway 2 in the fall. It just says that there's one that is currently happening that started in March.
Hold on, let's see if I can. So I'm going to share my screen.
Okay.
So is this what you're looking at?
Yeah.
Okay, and then do you see down here, apply now?
Oh, over there. Okay.
Yeah, we did not design the website.
I won't blame you. Okay.
But
And
that's
then
where it is.
And then if there's the other question that I had is something someone else was asking too about jobs as an IBCLC if you aren't an RN and what the outlook of that is, if you could speak to that at all.
Yeah, that's a good question. And honestly, a lot of that has to do with geographical location, from kind of looking at the lay of the land in various states. So some areas, and also it kind of depends on what are you interested in doing. So if you're interested in working in a hospital setting, then a lot of hospitals will only hire RN IBCLCs, but not all. And I would say that really is location specific. So my first recommendation would be kind of look at your hospitals in your area, if that's what you're interested in, and see like if there are job postings, are they requiring RN or are they only requiring IBCLC, that sort of thing, and kind of get an idea of it. Then there are very successful lactation clinics where they are not necessarily RN owned or operated, and they hire non-RN IBCLCs and they can, fully function, and they're very successful. So, and there are also people who think, I'm not an RN, I don't want to work in a hospital, so I'm going to start my own practice. We always emphasize that you want some experience before you go out. Maybe you've already had experience, I don't know. But, not everybody after they graduate is ready to start their own private practice. But that's what a lot of people kind of start looking into as well. So not to be really vague, but it kind of depends, to be honest.
Okay.
What your area is. I mean, we do work with hospitals where they hire non-RN IBCLCs. So it's not a never situation, but I do find that it tends to be very geographically specific.
Okay. Okay.
Bree?
Can you hear me?
I can.
I have two questions. My first is, I know you mentioned that the Pathway 2 course is 3 quarters. Is the $7,500 due when you sign up all at one time, or do you pay that over the 3 quarters depending on which class you're doing in that quarter?
It's 3 quarters, but it's all together. So you don't start and stop. So your tuition is due within the first month of the program.
Okay. And then my other question is, I'm currently a NICU nurse, and would probably plan to hopefully do my clinical hours at my hospital that I work at. We have a lactation team that has 2 IBCLC nurses. Would I be able to do hours between the both of them, or would I have to pick one and only stay with that one for the whole 300 hours?
Yeah, so from our point of view, you don't have to pick only one. And certainly you want, I think it's actually great to have more than one preceptor, because I think everybody has their own style and you learn different things from different people. So I think that's awesome. It would just depend on them. So if they both are willing to be your preceptor, the affiliation agreement that we have is with the facility, and anybody who works in that facility can be a preceptor. So it's really just up to them.
Okay, and so that would also then include our outpatient clinic that's through our hospital. Like I would be able to go with that IBCLC as well too if I wanted.
Yep, as long as she
If they,
agrees.
okay,
Yep.
perfect. Great.
Yep.
Thank you so much.
Sure. Yeah. Janine?
Hi, I also had the question about the tuition, like when it was due, and so it's due the first month of the start of the Pathway 2 course?
Yeah, Megan, Megan, can you speak to that? I think Carol's.
I am so sorry. I like Carol, I'm trying to answer all the chats and I
can
don't
answer. I did
listen when I'm typing.
When the balance of the Pathway 2 tuition is due.
It's due at the start of the program. So I think it's if you're interested in starting in the fall, it would be due like August 25th or something, just like a couple weeks right before the program starts.
Okay. And then I saw another question in the chat that really made me think about something too. They're talking about, because I'm currently taking the lactation education counselor course. So I'm like at the very end, and we just did a project, and there was a checklist for like the certified lactation counselor counseling skills attestation. Do you have to check, like, just a scenario, do you need to have every single box done, checked off in order to apply? Or like, if they grade you and it's like not 100%, say it's like 93% or 98%, does it have to be 100% in order to use that checklist to apply for the lactation or for the exam to
For the
become
CL,
for
yeah,
the CLC?
Yes, for the CLC exam, it does have to all be checked off. That's their requirement. So
Okay.
that's their checklist that they've given us to make sure that people are doing what they require in order to take that CLC exam.
Okay, so in the grading, it's either like 100% or not. It's like 100% or bust, basically, if you don't get.
I mean, have you done the project yet?
Yeah, we did the project already. It's just, I guess, computers were stolen or something, so the grading's behind.
Yeah.
So yeah, she hasn't graded. I haven't received a grade yet. So I was just curious, and I saw that question on the.
Yeah,
on the
it's not the
chat.
grade that CLC wants, it's the checklist. So as long as you covered all of those skills in your video, then that should be fine.
Okay.
Christina, also on that topic, say she forgot to do the manual expression demonstration. She gets her checklist from the teacher. She can print up another one of those sheets, and she can go to the LC at work and say, hey, you know what? I didn't do this in my counseling session. Can you observe me teaching a mom how to manual express? And she can observe you, she can check it off, she can give you her resume, and you're good to go. So
okay. I'm an RN, but I don't work in a labor and delivery unit. So I would have to, that would be something that I'd have to seek out, I guess. I'd have to find a.
Yeah, if you're in that situation, because I'm guessing, only because I know whose computer was stolen, I'm guessing that you're talking about Christina's your instructor. So you know, that's a conversation you can certainly have with her if it comes to that.
Okay. All right. Well, thank you.
Keila?
Yes, I have a question. I am CLC and also peer counselor with the WIC program, been working with the WIC program over 20 years. So do I need to retake my CLC? I did the exam already. And what besides the 14 courses, what additional do I need to take?
So it sounds like if you're already a CLC that you took your 45 hours previously, that's what allowed you to take the CLC exam, right?
It was in 2000, but I kept up my certificate. You know, I was turning in my hours, so it's all up to date.
Yeah, so that's fine. So then you don't have to do the LEC course as a prerequisite because you've already done something like that. So you just need to make sure you have if you're interested in the pathway 2, you would need to make sure you have the 14 health sciences.
Okay, so do I apply for pathway 1 or 2?
Well, if you're interested in getting clinical hours through our program, that's only pathway 2.
Okay, I already have the hours because I'm a peer counselor, so I work with breastfeeding moms, and we do have IBCLC I've been working under, so I do a lot of hands-on helping mothers breastfeed with the breastfeeding. So that would put me into pathway 1 after I complete the courses.
Yeah, it sounds like you would be more pathway 1 since you don't need to do clinical hours. You've already done them.
Okay. And what is the fee for a pathway 1? I was looking at it. It was kind of confusing. So the courses is additional to the, so like how many hour courses you take, that's going to be additional fee, right?
The pathway 1 program is 6 months. Is that what you're asking? The pathway 1, the didactic, it's 6 months over 2 quarters. The price is, the fee is $1,195.
Okay. And you can only apply after you completed the 14 courses.
No, that one, well, that's an LLC requirement that you're already a health professional or that you've done that. So the idea is that you've already got all of that because you're a health professional.
Okay.
So if you have transcripts that you want, you can send those to Carol if you want her to look at those and see if they would make you eligible for pathway 1.
Yeah, I do need to take courses. I think I still have like 10 courses. I need to take 10 or so.
Oh, okay. Okay.
So then I would wait to take that course until I finish all the courses, right?
Right. It sounds like it. You could send your specific question to Carol and just talk to her and make sure that that's the right direction. But because pathway 1 is geared towards health professionals, I think that that is correct, what you're going to have to do.
Okay. Thank you.
Uh-huh. Lucia?
Hello?
Hello?
Hi. Sorry, I had trouble unmuting. Thank you for letting me answer a question. These have to do with the expectation as far as time commitments to the LEC courses in the pathway 2. I am an RN now and I have a background in NICU, but I'm going to be working in a clinic Monday through Friday, 8 to 5, and it's pediatric. So I won't have, I'm just trying to see like where I might be able to fit that in once I am able to complete the LEC course, or how I might need to shift my schedule.
Yeah, to do the pathway 2. That's hard because
Yeah.
it sounds like you pretty much only have weekends available.
Mm-hmm.
Right. So we don't have I don't know of a preceptor that only works weekends.
Mm-hmm.
That is a possibility but not every site offers weekend hours. So it does limit if you don't have any flexibility in your schedule, it does limit your options. And we can certainly try and see if we can find you a site that has weekend availability, but you will be possibly working one day, if not both days every weekend to finish your hours, depending. Because that's the other thing. Some sites, their LCs work 10 to 12 hour shifts or 8 to 12 hour shifts. Some sites, if they're not as busy, their LCs might work 4 to 6 hour shifts. So that's the other piece of it. If you're only available Saturday and Sunday and you're only working 6 hour shifts, it's going to be tight for you to get those hours.
Understandable. So if possible, just trying to get at least 1 or 2 weekday availabilities would be.
Yeah. Where are you located?
So I'm going to be moving to San Diego from Denver in about a month, and I'll be working in the North Park area.
Okay. So, I mean, San Diego does have some I mean, I know one LC preceptor who works the night shift if you want to work the night shift, but I don't know. I don't know what days she does, but I mean, there's some possible, I just don't want to guarantee it because I don't know. It kind of depends on when that time comes, who's available, what shifts are available.
Yeah, I mean, this is a goal of mine. So if like the only weekend night shift was available, then I'd be happy to include that in my schedule somehow. But I wanted to see what my options were, how I might need to shift with work.
It is tough. And it is limiting, but all I can say is we can try.
Okay. Thank you so much.
Okay. Christina.
Hi. So for the pathway 2, I'm wondering, since the clinical hours are concurrent and those are about 10 to 12 hours a week approximately, with the classes added on to that, how many hours per week are we looking at for total commitment?
Yeah, I would say that for the pathway 2, the recorded lectures probably come out to about 5 hours each week, and then you have readings and assignments on top of that. So, I mean, to be honest, it is like a part-time job in terms of the rigor of the course. The pathway 1 is, you don't have the clinical piece of it, but all of that didactic is smushed into 6 months. And so, you have more lecture hours for lectures each week. But for pathway 2, I would say it's probably anywhere from 5 to 10 hours if you're thinking of recorded lectures, readings, and assignments all together. And then on top of that, your clinical piece.
Thank you. Also, for California specific, for the difference between CLC and IBCLC, it's really hard to find California specific information on what the difference is between, I mean, like overall, I know the difference, but for scope of practice and job prospects, do you have an idea of what the real difference is between them?
Well, when you're looking for a job prospect, usually the job posting is going to say that we will take a CLC or an IBCLC, or we only take an IBCLC.
Okay.
Yeah, Rose, I feel like you have something you want to say.
I think probably the biggest difference is the lactation educator, the lactation counselor, and somebody else had a question about what's the difference between an educator and a counselor. Well, there's not. They're basically the same thing. It's just different agencies call it something different. But probably the major difference is the lactation educator is educated in normal breastfeeding management, whereas the IBCLC has gone a further step and handles the more complicated cases. So as a lactation educator, you see somebody who is, really tough, maybe has a tongue tie or has a disorganized suck, that you are not necessarily trained in, so you would refer her to an IBCLC. So that would be the difference.
Thank you very much. I appreciate that.
Yeah, okay. Google Pixel. I don't know your name, but you're next.
Sorry, I'm new to Zoom, so I'm figuring this out. I didn't identify myself. I'm Christina.
Hi.
And I was wondering, when you do the prerequisite of the LEC 45-hour course before Pathway 2, do you have to sit for the CLC exam? No.
You don't have to sit for the exam. That's just an option. So we just provided this course that fulfills the prerequisites or the requirements for the academic and the counseling skills for those who choose to take the CLC exam. It's just an opportunity, but it's not a requirement.
Okay, I understand. Awesome. Thank you.
Yeah, Sandy.
Hi, good afternoon. I guess you kind of asked my question as well. I'm sorry, I was having issues with my internet. For Pathway 2, I just wanted to double check. It's the completion of the 14 general education courses if you're not a health professional, and the LEC program, but you don't have to take the exam, correct? Because you need to either
CLC.
because you would have to have a BA or as well be a healthcare professional. And those are the only two prerequisites in order to apply for the pathway 2.
Yes, the CLC and all the 14 health sciences.
Okay, well, thank you so much.
Okay.
I appreciate it.
You're welcome. Grimmett?
Hi.
Hi.
This has been great. So I'm a childbirth educator for UCSD and also a doula, and I'm currently do a lot of postpartum help with moms to breastfeed and whatever. And I do know my limitations and refer them to an IBCLC, but I'm wondering, as far as taking the LEC course, is just taking that course enough to qualify to sit for the CLC exam?
There are other, you should look on their website, alpp.org is
okay,
where you would find that information. They're the organization that gives the CLC exam. And they have 3 different pathways for you to figure out which one works best for you to become a CLC. And there's some other prerequisites. So one of them I know is they require a bachelor's. It doesn't specify what that bachelor's has to be in, I don't think, but you have to have a bachelor's. So we provide the academic requirements, we fulfill the academic requirements and the counseling skills, but there are other requirements that ALPP might stipulate that you should look to see if you've completed those as well.
Okay, so I do not have a bachelor's degree in anything, let alone healthcare. But so I'm wondering then, what would be beneficial to me besides learning more about breastfeeding to take the LEC course? What can it really allow me to do besides, is it okay to publicize or to be recognized as completed the LEC course?
Are you asking in terms of job prospects? Like,
because I have my own business. So I just create a relationship with my clients and they look to me to give them advice and help with lactation and latch. And I am trained to identify tongue ties and those kind of things and assess their latch and that kind of thing. But I don't have I've never taken the LEC course. I simply have certified childbirth educator, and I have 5 years personal experience and been helping moms for the past 4 years, as in the trenches with them, and as a doula working as a volunteer for UCSD, and helping moms get that initial latch at the hospital right after the baby's born, and have over 1,000 hours as a volunteer and, helping for the past 13 years as a volunteer doula.
Yeah. So what I would say to that is, I think that if you took the LEC course, that would really, if you want to really provide lactation support even more so, I think the LEC course, it's jam-packed. Those 45 hours, you're going to get a lot of information. And even if you aren't able to do all of the clinical things that we talk about in that course, because they're a little bit more complex than what a CLC scope of practice might be, you do hear about those, you do learn about those, you do talk about those with your instructors. So it does not dive as deep as Pathway 1 and Pathway 2, but I suspect it dives deeper than what an educator program, like a lactation education program through a doula course or something like that. It probably dives deeper into that because it is just so focused on lactation specific information. And then if you were to take that, even if you weren't the CLC, my recommendation would be that you're just really honest with your clients of what you are, who you are, all of that, which sounds like you are. So that's what I'd say. But I do think that the LEC 45 hours, if somebody really wants to focus on providing lactation support, I think it is a good course to give you a really solid foundation.
Okay, so I couldn't, underneath the umbrella of being a childbirth educator, teach lactation? with just having the LEC course completed without taking the
You could
CLC.
certainly after the LEC course, after you've taken the LEC course, I would think definitely you could teach a breastfeeding class or incorporate that into your childbirth class, certainly.
Okay.
Yeah.
I think, Christine, I think the biggest difference is you just don't say I'm a certified lactation educator.
Correct.
You're basically a certificated lactation educator, but that, yeah.
Okay.
Yeah.
All right. Thank you.
All right. And our fourth Christina of the night, I think. Christina, are you there?
There's a lot of us out there. So I guess I have a two-part question.
Okay.
I think my main issue is I'm trying to decide what is sort of better for what I do. I'm a pediatric triage nurse. I work in an ambulatory clinic, so I work with lots of new moms, breastfeeding moms. It runs the gambit. And we see babies at different stages of life. So I'm trying to figure out, is it beneficial for me to do the LEC course and just get a basic understanding? Or is it more beneficial for me to go pathway 1 since I have the option to, I've already been doing hours, like doing breastfeeding support. I guess I'm wondering which is like more beneficial. I don't know. I'm able to get the hours, like we can work it out with my manager to make sure that I'm able to see those clients and those patients individually. But I guess what's the biggest difference? And my second part of that question is, if I'm taking the pathway 1, is there an option like when you hit 45 hours to take the CLC exam while you're working on your 1,000 hours of IBCLC? Does that make sense? Sort of,
Yes.
maybe?
Two-part question. The first part I'm going to answer is which, is beneficial for you for LEC pathway 1. So honestly, I mean, only you can answer that for yourself. But what I would say is that I guess because the reason why I say you can answer that is because what do you really want to do with it? So if you just want like some basic, because you see some breastfeeding dyads, not a lot, you want to be able to support, you want to, speak a little bit more clinically and intelligently about the situation, probably the 45 hours work. But if you're looking to really problem solve for those complex issues, to really create feeding plans, to really assess a clinical situation that's not working the way we expect it to, that is like what Rose was saying, a more complex level of care and, a more complex knowledge. So, I mean, I think that's really the difference, and that's where the IBCLC would come in.
Excellent. That actually really helps.
And then your second part was, remind me where your second part was?
So my second part is, I know
for the
your
45 hours. Yeah.
Yeah. That
so in order to take the CLC exam, you do have to have your instructor's resume, and you have to have this clinical skills list. So if you have somebody in your clinic who can do that, an IBCLC or a CLC in your clinic, who can say, yes, I checked her off, she can do all of these skills, and here's my resume, then you can submit that at any time. That piece is not built into the pathway 1, like for our program, like it is built into the LEC course, because the idea is that most of the people in the LEC course are going to go and take the CLC exam. But most of the people on the pathway 1 are not. They're going to take the IBCLC exam.
Okay. So I guess what I'm hearing is LEC course is more of like a deeper dive into more knowledge about breastfeeding. Pathway 1 is more of a let's problem solve some deeper issues that may be going on, and like really making like feeding.
Yeah, it's just more complex.
Got
I think it's more complex. I mean, Rose, how would you say that? It's more critical clinical thinking, I think.
Got it. Okay.
Exactly. That's what I would say.
Perfect. Okay. No, that was extremely helpful. Thank you very much. Appreciate it.
Sure. Yeah, Raksha?
Sorry, I had another question. So, in case we take up the pathway 1, and is there an application deadline for that too, just like the pathway 2, or if there is no?
The pathway 1 course is offered every quarter, And generally, if you can get your application in by the time the class starts, that's fine. So our next class begins in, I don't know the exact date, September. So, no, I'm sorry, June, the June class. I'm sorry about that. So yeah, you can submit your application anytime. And it generally just takes a day or so to review it, and you can kind of move on from there.
Okay, and once we finish the pathway 1, so how much duration can we leave it between finishing the course and the exam? So let's say the exam is in March, right? There's one in March and one in September too. So if I finish the pathway 1 course now, so is there any time limit that I can give my exam in, like that I have to give it next year, or can I even prolong it later, like maybe after 2 years?
Your didactic and clinical all expire 5 years. So you have to take the exam within 5 years of completing your didactic and your clinical hours.
Okay, five years. Okay, thank you. Thank you so much.
Yeah. All right, we have 2 more. Thank you for your patience. 2 more questions. Dorothy? Dorothy, are you able to unmute? Do you hear me? I don't think you hear me. Okay, we'll go to Liliana and then we'll come back to Dorothy if she can hear me.
Hello.
Hello.
I have a question. So I'm looking at and I'm sorry if someone already asked this. I got kicked out of Zoom, and when I came back, the messages were gone. But for the lactation education counselor course, I see that it gives us the option to either do it for a letter grade or not for credit. Does it matter which one we choose? Is there a preference for pathway 2?
For the lactation education counselor course, Carol, do they have to, or Megan? That I think you can take that past.
I'm so sorry. Could you repeat? Is it about grading options? Sorry.
Yeah. For the LEC, if they want to take it as a prerequisite for pathway 2, do they have to have a letter grade, or can they take pass fail?
I think they can take it for a letter grade or pass fail, right, Carol?
Yes, that's correct. Yeah.
Thank you.
Sure.
All right, Dorothy, can you hear me now? Dorothy, I'm pointing at you.
Hello?
Hello?
Hello, hi, this isn't Dorothy. Can you hear me?
Oh, yes. Did you have a question?
Sorry, I'm on the phone. I don't have Zoom, so I didn't know how to ask the question, but if Dorothy isn't answering, may I ask mine?
Sure.
Okay, so I finished my 14 health classes and I'm going to apply for pathway 2. The only thing that really was stopping me was trying to come up with the $8,000, but now that I know I have a month from when we start, that's perfectly fine. Now my question is, I'm worried about not succeeding in the pathway 2. Let's say I complete all my hours. Is there any chance, is there like a final, like in college, like do we have to take any exam after we complete pathway 2?
You have assignments and tests, like quizzes throughout the program that you have to take. And honestly, the only way somebody would fail is if they didn't do the class. You might not get an A+, but you will pass the course. The only way you wouldn't is if you didn't do the work.
Okay, good. Yeah, I saw that people that take the IBLCE exam, I believe it was like an 85% that pass.
Oh yeah, so
and is there any way
something different? That's not our course, that's the actual.
Yeah, that's the actual sit-in exam. I was just wondering for pathway 2, is it 100% so far? Have you guys had 100% pass rate?
Yes, for pathway 2, yes.
Okay, thank you. That was my question.
Yeah. Athena?
Oh, okay. I asked this in the chat, but I thought I would just pop on. I'm trying to find it back. Oh, I'm sorry. You got to me faster than I expected. Okay, I will just email you if I come up with it.
Okay.
It's not
Okay.
going to be.
All right, well, I think that wraps it up. So,
well, I have my hand raised, but you never called on me.
I did. I called on you 3 times, but I don't think you heard me. So ask away.
My mother-in-law's name is Dorothy.
Oh, then it's her phone. That's probably what it is. That's what it
really
said your name is.
I don't know why it's saying that. My name is Natasha, and it's nice to meet you.
Good to meet you.
So I'm enrolled in the program. I believe it ends it's from September to May, correct?
For the Pathway 2 program?
Yes.
Yeah, it'll be in the first week of June.
Oh, first week of June. Okay, and then you take the exam in the fall, correct?
The IBLC exam, I'd have to look at their website to see what their time is. So when you usually apply for the exam in either fall or spring, and then you actually take the exam 6 months later.
Oh.
And that's an IBLC thing. They only offer it twice a year.
So the people that finish your program, sounds like they have to wait till spring to take their exam.
If they finish the cohort that just finished now, they finished this month in June. The application period is happening right now. So they're applying for the exam right now, and they're going to take the exam in the fall in September.
Oh, July, August, that's only 3 months. So I'm confused.
Yeah, that's a lot shorter. That's the shortest it's ever been. Usually it's about 6 months. So I don't know. That's why I'd say I don't know if they're going to change in the future and always make it shorter, but traditionally, other than this one time, it's usually a fall spring thing. You either apply in the fall to take it in the spring, or you apply in the spring to take it in the fall.
Okay. And then I would rather take it as soon as possible. But anyway, so, and what percentage of your students pass the exam?
The IBLC exam, we have an 80. I think the last couple of cohorts have been like 83 to 86% pass rate.
Okay. And then how much does it cost to take the exam, and how many questions are on it?
I don't know the exact cost. You should go on the IBLC website to look at that. And the exam is 175 questions.
Okay. And then what percentage do you have to get to pass it?
I'm not sure. I think it's something like 70-something%, but you should look on the IBLC exam website because they're the ones who create the exam.
Okay, I will do that. Thank you so much.
All right, great. All right, thanks everybody so much for coming tonight and asking all your great questions. Thank you for sticking around till the end. If you have specific questions, again, you can email any of us at any point. All right. Good night, everybody. Thank you.
Thank you.
Thank you.
Thank you.